it's huge, and it's very exciting. I mean, we're really in a very exciting time now when we're talking about Alzheimer's research because
Jay Reinstein is 62 years old. He was diagnosed 4 years ago with early onset Alzheimer's.
it was a shock to me because I just thought I had a lot of information in my head. It was information overload, and in fact, it was not.
Jay is ecstatic to try one of the new Alzheimer's medications, despite the risk of brain swelling and bleeding.
To me, the risk is worth it if it gives me 6 more months, another year with my kids, my grandkids, my wife. Lecanemab in particular is something that's giving me hope, and it's very exciting.
Lecanemab, also called Leqembi, may soon be joined by a second drug, donanemab. The Alzheimer's Association hopes it gets FDA approval by year's end. These drugs are different than current medications because they don't just treat the symptoms.
This is actually looking at protein deposits in the brain that are associated with Alzheimer's disease. And in the clinical trials, they showed that they were successful in clearing out much of these protein deposits, and people who were in the studies experience lower progression of symptoms.
Developments in the diagnosis of Alzheimer's include PET scans.
It has a tracer in it that enables these protein deposits to light up in the brain of the individual with Alzheimer's that leads to a much more precise diagnosis.
I think it's amazing what we're seeing happening now, and with the advance of some of these other testing processes, it will be huge and identify probably a lot more people with the disease than we know have it now.
The downside to the PET scans, they aren't typically covered by insurance and they are very expensive. Something the Alzheimer's Association is even more excited about, though, is the potential for a blood test to detect Alzheimer's even before any symptoms begin. They're hopeful that begins or becomes a reality within a few years, and it would be an absolute game changer.